Today I'm going to be talking about a poster that I presented with the title of Phase 1 Dose-Escalation Study of Venetoclax plus BEAM and autologous stem cell transplant for chemoresistant or high-risk relapsed refractory non-Hodgkin's lymphoma. So as we're probably all familiar, high-dose therapy with BEAM and autologous stem cell transplant remains the standard of therapy for patients with chemosensitive relapsed and refractory non-Hodgkin's lymphoma. That includes both the B-cell subtypes and T-cell subtypes. Patients who have an inadequate response to salvage chemotherapy generally have a worse prognosis. We postulated that we can overcome this chemoresistance by the addition of venetoclax to the standard conditioning regimen of BEAM. So we're presenting here the results of the Phase 1 dose escalation trial of that study. This was an open label, single center study with a dose expansion cohort. We combined venetoclax with BEAM. The venetoclax was given 10 days before the transplant, and we had 3 dosing cohorts, 400 milligrams, 800 milligrams, and 1200 milligrams. We did not encounter any dose-limiting toxicities, so we were able to open the expansion cohort of 10 additional patients at the 1200 milligram dose. The inclusion criteria was fit patients who were adults with refractory non-Hodgkin's lymphoma after upfront induction therapy or high risk, and we defined high risk as having been exposed to 3 lines of therapy or relapsed within 1 year of primary chemoimmunotherapy, or at high risk of relapse after autologous stem cell transplant. We excluded patients with CLL or SLL or CNS involvement, and we mainly looked at the safety and the maximal tolerated dose, and we used standard reporting criteria for the adverse events. So overall, we had 19 patients. They were pretty representative of the population that we generally see in our clinics. They had a median age of 61. The vast majority of them were male, 79%. Most of them, 79%, also had stage 4 diagnosis. And the vast majority of the histologies was diffuse large B-cell lymphoma and then mantle cell lymphoma, with a few other follicular and anaplastic. Only a third of the patients were in complete response at the time of the transplant, with 37% being primary refractory and 26% being relapsed. Also to note that 47% of the patients had a positive PET scan prior to autologous stem cell transplant. In terms of the safety of this combination, so we did not encounter any dose-limiting toxicities. The toxicities that we saw were mostly congruent with what we see with general autologous stem cell transplant. The median day to engraftment was also fairly reasonable with historical controls for patients undergoing autologous stem cell transplant. The median day for neutrophil engraftment was 10, median day for platelet engraftment was 19, and the length of stay in the hospital was 19 days also, which is very congruent with what we see in other studies and with standard of practice. We also presented here the median progression-free survival and the median overall survival for these patients. Even though this is just a Phase 1 study, the median progression-free survival was 398 days, and the median overall survival was not reached yet. So in conclusion, the addition of venetoclax to BEAM appears to be safe from the study and well-tolerated. An elderly, heavily pretreated population who have high-risk disease. Now, we do understand that, there are a lot of competing treatments for some histologies. For example, there's CD19 CAR for diffuse large B-cell lymphoma, which was also recently approved for mantle cell lymphoma. However, there's a few other subtypes of non-Hodgkin's lymphoma which do not have, great options aside from autologous stem cell transplant. And, preclinical data has shown that venetoclax may be able to overcome the chemoresistance of these tumors. So it might be a good idea to kind of explore this further in other subtypes of non-Hodgkin's lymphoma. A further step for this would be, obviously a larger study, but then also using venetoclax for maintenance post-autologous stem cell transplant for these high-risk histologies. The treatment of relapsed refractory non-Hodgkin's lymphoma, really remains an unmet need, with a lot of patients being either too sick or progressing too fast for some of the therapies that we have, and we definitely need more options to try to salvage these patients. Venetoclax appears to be a promising medication with multiple effects. It is active as a single agent and in combination, and it's good to explore in further studies.